In this video, Patricia, Rita, Lena, and Radha will be exploring the research question, what are the benefits and challenges of using telemedicine for support groups for people with eating disorders? Telemedicine refers to the use of communication and information technology to extend the reach of medical practice. Telemedicine is also a disruptive innovation that has changed how and where some patients receive their medical care. Some possible interventions in telemedicine include psychoeducation, clinical and peer-moderated support group chats, video conferencing for counseling, and personalized modules, or a combination of any of these types. One of the critical barriers in treating eating disorders is the model of treatment delivery, characterized by in-person, one-to-one sessions administered by a highly trained professional and in a setting that requires the client to travel to a private office or clinic. This raises some concerns about accessibility and stigma issues. Obstacles to entering treatment in the traditional model of delivery includes poor ethnic and cultural representation, a low concentration of mental health professionals in your area, accessing transportation to and from the setting, and attitudinal concerns like stigma associated with mental illness. Successful telemedicine will increase the proportion of people receiving treatment and increase their reach to individuals not served by current treatments. For example, CBT for bulimia nervosa delivered via telemedicine is just as effective as face-to-face treatment, but costs less. With the use of the internet and mobile apps, telemedicine will evolutionize treatment delivery and reduce the treatment gap by addressing the indirect costs of services, time spent in session, paying for babysitters, stigma, mental health literacy, long wait times, and remote geographic locations. Meet Zara. She's 19 and has been struggling with her eating behaviors and body image. She looks in the bathroom mirror, steps on a scale, and feels overwhelmed, exhausted, and stressed. There are a lot of things going on in her life where she feels a lack of control. She often restricts her eating, goes on various diets, and over-exercises. Zara knew that she didn't feel okay and wanted to seek some sort of help. On one particularly bad night, Zara went to her local hospital but was denied treatment. Despite the fact that she struggles every day and knows she's on a worrisome trajectory, she wasn't sick enough to be admitted and the doctors weren't skilled in treating her condition. Zara left feeling incredibly disheartened and deeply worried about the path she was headed down. She would then make an appointment with her family doctor to see her options. Zara wanted treatment from the comfort of her home and to remain in her community. None of Zara's family or friends knew what she was going through. Her family doctor recommended online group therapy, and that an organization called Body Brave offered online psychotherapy in a group setting. This would allow Zara to find a community of people who understand her, in a safe environment that would encourage healing. Zara was hesitant about this new treatment, but did her research and found that Body Brave addressed her barriers to seeking treatment. Those with eating disorders are unlikely to seek services due to perceived treatment barriers, including high financial costs, lack of insurance, and feelings of shame. However, Body Brave's online, cost-effective approach would help break down those barriers. Zara was open to joining the Body Brave community after she found that one study of online CBT group therapy for individuals with bulimia had similar levels of symptom reduction compared to face-to-face treatments. Another study showed that internet and group interventions for young women had greater reductions in risk factors, such as thin idealization. The primary clinical benefits of telemedicine approaches for support groups include reducing symptoms and risk factor outcomes, as well as increasing treatment compliance and sustainability. Other benefits to telemedicine approaches include decreasing stigma related to receiving treatment for mental illness, finding a community to connect with, reducing costs of care, and making care accessible for people in remote areas. While video conferencing can be on a secure platform, some other forms of telemedicine, such as email and text messaging, are not secure. As well, participants can also be worried about finding people that they know on the platform and potentially exposing their identity and eating disorder in the process. The digital divide in IT literacy can affect user acceptance of telemedicine. People with low health and IT literacy are less likely to report perceiving telemedicine as useful or easy to use. There are also cultural and social inequalities in terms of accessing virtual care, especially in rural and urban areas or among Indigenous communities. Telemedicine can blur boundaries between public and private spaces. Zara's bedroom and computer became associated with therapy. There was competing anti-recovery and pro-recovery content online. And since nonverbal cues and body language were largely missing, Zara found it more difficult to convey exactly how she was feeling and acted differently online. A major benefit of the support group model was that Zara was able to receive treatment on a weekly rather than monthly basis. This treatment model addressed the growing gap between the demand and supply of treatment services. In such a resource-constricted field, telemedicine has provided Zara with access she otherwise would not have been able to get. Patients like Zara could receive more consistent support and benefit from the peer aspect of therapy. A pilot study in England facilitated online group chats for people with eating disorders. Their participants enjoyed the practical advice, sharing their problems, and listening to other people's experiences, which helped them get closer to the solutions for their own problems. Online peer-to-peer support services increase Zara's self-efficacy, enhance her coping strategies, and reduce her feelings of social isolation. However, without actual professionals administering treatment, these forums are ineffective for symptom reduction. After considering the benefits and challenges of using telemedicine for support groups for eating disorders, we recommend that Body Brave continue providing telemedicine support groups through video conferencing, as well as through group chats, as they can be more cost-effective in the long run, improve organizational reach, and contribute to patient satisfaction. Body Brave will experience implementation challenges including administrative, technological, clinical, and security issues, but can address these issues through a blending of different treatment methods, consent forms, emergency support plans, professional equipment, and downloadable resources. To enhance their services, we also have some recommendations for Body Brave. Organizations that support individuals with eating disorders should implement peer-to-peer support group chats and video conferencing, as well as moderated forums. These forums can be moderated by a clinician or a highly trained peer mentor. Telemedicine approaches to treatment should occur more consistently and for shorter periods of time to keep engagement and adherence levels high. For example, twice a week for 1 hour rather than once every 3 weeks. It should also have personalized content relevant to the individual and a personal follow-up session as needed for each individual in the video conference or group chat. To conclude, telemedicine for support groups is an effective approach for Body Brave's low-risk eating disorder patients. What will benefit patients at Body Brave is the ability to chat with other peers through a forum and the increased accessibility of telemedicine. Despite facing some social, personal, and clinical challenges, telemedicine has the potential to transform care. We would like to give a special thank you to our organizational partner, Body Brave, and our team champion, Dr. Cynthia Locker, for supporting us in this research project.